Menopause affects South Asian women up to 5 years earlier, with symptoms that are quite often misunderstood and care that is harder to access. Today, we're delving a little bit deeper to understand why. Welcome to the Women's Health Clinic. I am Katie Pier Allen, one of the menopause specialists here. Today, we are going to do a deep dive into menopause care for South Asian women. We're going to try and work out why differences occur and, most importantly, what we can do about them. Try and stay with me to the end because we are going to give you some really important takeaways that hopefully will help you on your menopause journey, or if it hasn't begun yet, to understand what's in store. Brain fog, mood swings, low confidence, things that affect us all in perimenopause or menopause, but things that in the South Asian community are rarely talked about. There is often quite a lot of stigma associated. Mood changes, brain fog, low confidence. These are things that in the South Asian community are rarely talked about. Psychological symptoms such as mood changes, anxiety, irritability. These are symptoms that are common in perimenopause and menopause, but are associated with a stigma. They're not talked about in South Asian communities. Women often feel like they have to wait until they are at breaking point before they reach for help. As our nurse advisor, Guinevere, explains, quite often women won't reach out for help until they feel like they can't take any more. And what we're here to do is to provide support and information so women can access help and understand their symptoms a lot better. If you haven't been feeling like yourself and you can identify with some of these symptoms, it's not weakness, it's perimenopause, it's menopause, and you deserve some help. When we're looking at overall HRT use, only 6% of women in the South Asian communities use HRT. Now that is compared to the 23% of white women that use HRT in the UK. When we're looking at why is HRT use lower in South Asian communities, well, we are looking at stigma. We're looking at health inequality, and we're looking about myths and beliefs about HRT and what it can do for you. Don't wait. Don't wait until things get so bad. Ask for help early, because actually HRT and proper menopause care could really change your life. In some South Asian communities, there isn't even a word for menopause. Imagine how that shapes a conversation. In some cultures, menopause is purely seen as a loss of fertility. In some cultures, it's not discussed at all. And imagine how that feels as a woman that has to quietly endure her symptoms. At the Women's Health Clinic, we have realized that if we create a culturally safe space that allows women to feel like they can open up about symptoms that they hadn't previously associated with menopause or hormonal changes occurring in later life. So why is this a concern for South Asian women? Well, if we're talking about an earlier menopause, then we're talking about longer without your hormones, without your protective hormones such as estrogen. Your bones will carry you for life. Protect them now. It is never too early. When we're looking at the risk of cardiovascular disease, we know that a loss of estrogen increases your cardiovascular risk. Now, when we're looking at the South Asian community, there is a higher risk of cardiovascular disease inherently. Now, that means that these women are at higher risk of cardiovascular disease even before the menopause. It's really important that this becomes a conversation and we can mitigate that risk. For South Asian women who are already at higher risk for diabetes and cardiovascular disease, we need to make sure that we're acknowledging this risk in order to provide regular health checks and to make sure that at best, this risk is being mitigated. It's not just about HRT. There are many other non-hormonal ways to manage your menopause. It's really important that in this phase of life, you access good quality care with somebody that can provide you on information. It's not just about HRT. There are many ways to manage your menopause. It is multifaceted. There are non-hormonal treatments as well as hormonal treatments. Did you know that NICE says that every single woman should have an individualized menopause assessment? Perimenopause, menopause, something completely natural, yes. Something to be endured, no. There are many ways to treat your menopause, but today I am going to talk about HRT, hormone replacement therapy. And in actual fact, it's not replacement. We are topping up your hormones with a bit of estrogen, progesterone, and testosterone. Now, that's super important when we're looking at alleviating your symptoms, making you feel better. But also when we're talking about living long, healthy, happy lives, it helps protect your bones, your brain, and your cardiovascular system. So is it for everyone? No. But actually, we know that for most women, the benefits of HRT will outweigh the risks. It's super important that you have somebody to talk to that knows what they're doing.